Laval, Quebec researchers tested DHA omega-3 to see if it offered neuroprotection in mice. The mice were divided into two groups. One fed a diet heavy in DHA omega-3, and the other a normal diet. Both groups were injected with MPTP, and the DHA-fed group was unaffected by the neurotoxin, while the other manifested classic Parkinson's symptoms. The drug-affected group had a 31% loss of dopamine-producing neurons, and a 50% decrease of dopamine levels. Laval researcher Dr. Calonne recommends a minimum of 250 milligrams a day. I take between 5 and 600 milligrams a day of molecularly distilled DHA omega-3. DHA is the structural omega-3 of the brain, but is unstable and easily oxidized. DHA should be supplemented with its precursor, EPA omega-3. EPA inhibits the PLA2 enzyme from releasing DHA from nerve cell membranes and maintains cell integrity in the brain. EPA is a potent anti-inflammatory and inhibits the production of inflammatory products from arachidonic acid. Arachidonic acid is found in animal fats, including meats, poultry, and eggs. 249 Parkinson's disease patients and 368 non-Parkinson's disease patients completed a questionnaire, and arachidonic acid was significantly related to an increased risk of Parkinson's disease. Men in the highest quartile of arachidonic acid intake increased their risk by 3 times. Women in the highest quartile of arachidonic acid intake increased their Parkinson's risk by 2 times. Autopsy results from brain fatty acid profiles of L-DOPA-treated Parkinson's patients revealed Parkinson's disease patients who experienced motor complications due to L-DOPA had higher arachidonic acid concentrations as compared to healthy controls, or Parkinson's disease patients on L-DOPA devoid of motor complications. The ketogenic diet was developed in 1921 to treat epilepsy. The ketogenic diet consists of a diet of 80 to 90% unsaturated and monosaturated fat, a limited amount of protein, and almost no carbohydrate, similar to but different from the Atkins diet. 5 Parkinson's patients ate the ketogenic diet for 28 days and showed an average improvement of 43% as based on the Unified Parkinson's Disease Rating Scale. Parkinson's disease patients have mitochondrial dysfunction, and the ketogenic diet attempts to substitute the brain's main source of energy, glucose, with ketones derived from fat. Ketones are produced when the body is starved of carbohydrates, and fats are used as an energy source. Ketones pass the blood-brain barrier and activate mitochondria. Coconut oil contains 60% medium-chain triglycerides, and MCT are converted into ketones by the liver. A 74-year-old man on standard Parkinson's therapy, consisting of Sinemet, a dopamine agonist, and an MAO inhibitor, had worsening Parkinson's symptoms, and after 3.5 years he decided to take matters into his own hands. He discovered the website of Dr. Mary Newport called CoconutKetones.com. Dr. Newport reversed her husband's Alzheimer's disease with large doses of coconut oil. Gradually, he built up his daily dose of coconut oil to 8 tablespoons, 4 at breakfast, 2 at lunch, and 2 at dinner. Within a couple of days he experienced significant improvements, and though he still has symptoms, his quality of life has vastly improved. In addition, coconut oil improves the absorption of B vitamins, fat-soluble vitamins, beta-carotene, lycopene, CoQ10, calcium, and magnesium. Scientists from Louisiana State University discovered that docosahexaenoic acid, DHA, protects brain cells by preventing the misfolding of a protein resulting from a gene mutation. The mutation's called ataxin-1. Dr. Bazan's laboratory discovered earlier that neuroprotectin D1, a naturally occurring molecule in the human brain that is derived from DHA, also promotes brain cell survival. Neuroprotectin D1 is capable of rescuing the dying cells with the pathological type of ataxin-1, keeping their integrity intact. There is evidence that DHA omega-3 decreases levodopa-induced dyskinesia, and a clinical trial is currently investigating the potential anti-dyskinetic effect of DHA omega-3.